Hello, Dr. Michelle here, and today I wanted to talk to you about seasonal affective disorder or the winter blues or winter depression. So, seasonal affective disorder, also referred to as SAD, is essentially depression that we see seasonally. Most often we see that during the colder months, during the fall, winter, though it can occur, to my surprise, also during other seasons, such as like spring, summer, though that is less common. Some of the symptoms of seasonal depression is low mood, changes to sleep, mood, appetite, the joy in the regular day-to-day activities that we see again for 2 consecutive years during that seasonal time repetitively. And essentially, there are a number of treatment options as far as seasonal depression goes. I think many people are aware that antidepressants are obviously an option. What I'm finding is something that people are less well versed about is something called light therapy. And so light therapy is essentially exposure to a bright light source. A happy light is oftentimes what they're branded as, but it's a bright light different than your artificial lights in your household that are at a 10,000 lux, which is a unit of measurement of the light. So bright light exposure for 20 to 60 minutes every day during the months that the seasonal depression affects you, and that this is as effective as some antidepressants, as effective as talk therapy in terms of treating depression. It can be left in the bathroom when you're getting ready in the morning, in the kitchen when you're making breakfast, or in your office on your desk, and that exposure to that light can help with depression, which is super cool. We do know that there's a relationship between the depression and light exposure, so thus the correlation between those two things. There's also some research to link vitamin D deficiency and depression together, and we know that the majority of the body's vitamin D sources is really coming from sun exposure, which again makes sense with this winter, less sun exposure, more skin coverage when we're outside, and lower vitamin D status, though we don't necessarily have research saying that in correcting this we see a change specifically in seasonal depression, but we do see a link between those two things, and there are many benefits to vitamin D being up to sufficiency. So testing and not guessing is really key, because vitamin D is a fat-soluble vitamin, so we can hit toxicity, which we obviously want to avoid. But ultimately, when it comes to treating seasonal depression, we know that things like allergies can worsen depression, that there's a relationship between inflammation and gut health and depression. And so ultimately, really having a look at somebody's physical health at a whole and figuring out what specific things in that person need to shift in order to see a change in physical health and therefore mental health, and vice versa, can be a really great approach in terms of treating this. So I hope this information was helpful to you, and I'll see you next time.